Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, today we're jumping into a fascinating medical mystery. It's a case where one of the most basic things a doctor does, taking your blood pressure, might not just be a little off, but dangerously wrong. And it all centers on something called Osler's sign. So here's the central puzzle, right? A patient comes in, their blood pressure reading is high. The doctor does the logical thing, prescribes medication to bring it down. But instead of getting better, the patient starts feeling awful, dizzy, unsteady, sick. How could the right treatment for a problem actually cause another one? It just doesn't make sense. And listen, this isn't just some textbook theory. This is real. This quote comes from an actual case study of a 58-year-old man. Every time his blood pressure medication worked and his numbers dropped into the normal range, his dizzy spells got worse. His wife even said he seemed zombie-like. Wow. That's the real-world consequence when the numbers on a machine just aren't telling you the whole story. Okay, so to get to the bottom of this, we've got to do a little detective work. And the first step in our investigation is to unpack the name itself. Because, as it turns out, that's a huge part of the problem. You see, the name Osler sign is super confusing because it isn't just one thing. Depending on who you're talking to or what you're reading, it could mean one of at least 3 totally different medical conditions. They're all named after the famous physician Sir William Osler, and that ambiguity, well, it causes a lot of headaches. This table right here really helps clear things up. So you've got Osler's nodes, these painful little bumps on your fingers that can be a sign of a heart infection. Then there's another Osler sign connected to Graves' disease. But the one we're zeroing in on, the one that's the key to our mystery, is this third one. It's the one linked to a palpable pulse and a condition called pseudohypertension. That's our target. So if a doctor suspected this, how would they even check for it back in the day? Well, the main clue comes from a really simple, hands-on test. Something any doctor can do right there at the bedside with no fancy equipment needed.
And this is it, the Osler maneuver. It's incredibly simple. First, you put a blood pressure cuff on the arm and inflate it way past the systolic pressure. Basically, you cut off the blood flow completely. Then, you feel for the radial artery down at the rest. Now, normally, that artery should just collapse, right? You shouldn't be able to feel it. But if you can still feel it, if it feels like a hard little cord or a rigid tube under your fingers, then the test is Osler positive. So what does an Osler positive test mean? It points straight to the real problem, pseudohypertension. It literally means false high blood pressure. Think about it. If the artery is super stiff, the cuff has to squeeze way harder just to compress it. That extra effort gets recorded as a higher pressure reading, even if the patient's actual blood pressure inside that stiff artery is perfectly normal or maybe even low. It's a total illusion. Okay, so this begs a huge question. What in the world could make a person's arteries so hard that they feel like little wires and can fool a blood pressure cuff? Let's pull back the curtain and find the culprit. The condition has a pretty technical name, Munkeberg's sclerosis. You can also call it medial arterial calcification. And it's basically a process where the arteries start to harden, but in a very, very specific way.
Now, this is super important, so let's break it down. The key thing to understand is how Munkeberg's is different from atherosclerosis, which is the one we always hear about, clogged arteries. Atherosclerosis is plaque building up on the inside wall, narrowing the pipe. But Munkeberg's is different. It's calcium getting deposited in the middle muscular layer of the artery. It's not necessarily blocking the flow, it's turning the artery wall itself into a rigid, stiff tube. And you see it a lot in folks with diabetes, chronic kidney disease, and frankly, just as part of getting older. And we can actually see this. Here's our first piece of visual proof. On an ultrasound, these calcified arteries just light up. You see those bright white lines? That's the vessel wall itself glowing. That tells you right away that it's not soft and flexible anymore. But this is the real showstopper. On an X-ray, the calcification can get so bad that it perfectly outlines both sides of the artery, and it creates this classic railroad track look. Think about that. You are literally seeing the hardened walls of the blood vessel. That's something you should never be able to see on a regular X-ray. So there you have it, a simple bedside test for a condition where arteries get hard and give you fake blood pressure readings. Seems like a pretty neat and tidy story, right? Well, in science, it's almost never that simple. It's time to look at the verdict because this sign came under some serious scrutiny. Back in 1985, a study by a Dr. Messerly and his team seemed to prove that the Osler maneuver was the real deal. They found that, yeah, Osler-positive patients really did have falsely high cuff readings. And even better, the stiffer the artery, the bigger the mistake in the reading. It looked like they'd found a genuinely useful clinical tool. So, case closed, right? We can all go home? Well, not so fast, because science is all about questioning and retesting even when something seems settled. And what happened next is a perfect example of the scientific process in action. Let's just look at how this whole case played out. On one side, you have those really promising findings from 1985. But then, in the 1990s, other scientists tried to repeat the experiment with larger groups of patients, and their conclusions were completely different. What these newer, more rigorous studies found was that while the idea behind it was sound, the Osler maneuver itself just wasn't very reliable. Turns out, a lot of Osler-positive patients didn't have pseudohypertension at all. Some even had the opposite problem. That simple bedside test, well, it just wasn't the magic bullet everyone had hoped for. So you might be thinking, okay, if the test doesn't work, why did we just go through all that? Because the story of this failed test actually reveals a much deeper, much more important challenge that doctors face every single day. This whole curious case is so important for a few big reasons. One, it really shines a light on how difficult it can be to manage high blood pressure in older folks, where stiff arteries are just more common. Two, it's a huge reminder that we have to be critical of our data, even something we take for granted, like a blood pressure reading. And maybe most important of all, it hammers home one of the most fundamental rules of good medicine. You have to treat the patient, not the number on the monitor. You treat the person who feels zombie-like, not just the reading on the machine. And that kind of leaves us with one last big thought to chew on. The story of Osler's sign and Munchenberg's sclerosis is really about the blurry line between what's considered normal aging and what's considered a disease. As we all live longer, the biggest challenge for medicine might not be just finding new cures. It might be learning how to listen to our bodies and wisely figure out which signals are signs of a disease that needs fixing and which are simply the signs of a long life well lived.